Experts say we should see up to 100 million more people getting COVID-19 this fall and winter. Today, the U.S. has 83 million reported coronavirus cases and over 1 million deaths since the pandemic started. A new study finds the fourth dose of Moderna or Pfizer, already authorized in the U.S. for people 50 and older, is safe and provides for a substantial boost to immunity at similar or even better levels than a third dose. So, what is going on? Where are we with our doses? Dr. Alexea Gaffney, an infectious disease specialist, joins me to answer that question. Doc, glad to have you here. First and foremost, before we get to the fourth shot, let's deal with the third. Where are we right now on the rates of people getting that third booster? I just got my third booster yesterday. I had to delay that because I got the antibody. After getting COVID in December, I got the antibodies, and so I had to wait a period of time to actually get the booster shot.
Yeah. So unfortunately, we're not in a position where we are really changing people's minds. Whereas in the second surge of the pandemic, we saw a lot of people who weren't initially vaccinated rushing out to get the COVID-19 vaccines. We're not seeing that kind of increase in rates of vaccination. So we really haven't moved the number in terms of the percentage of eligible children and adults in the United States, rushing out to get vaccinated.
Is that because there was so much attention on the initial vaccine that then people said, okay, fine, I got it, I'm good, not realizing that dissipates, it begins to wane?
Yeah, I think there's a mixture of issues or concerns. Some people are saying, they told me it would be one dose, then it was two, now they're talking about a third, I'm just not getting a booster. And so the folks who didn't go out and get a third dose are certainly not interested in getting a fourth dose or getting a booster. There's been a failure to communicate effectively about the difference between getting a booster for some folks and some people, those of us who are moderate to severely immunocompromised, those of us who are very early. That third dose was not really a booster for those individuals. That third dose was the completion of the primary series, and now the fourth dose is being considered the same, a completion of a primary series for the people who are at really high risk, and it's a booster for those who are at average risk to have complications or hospitalization from COVID-19 infection.
So one of the things that's interesting, again, we're seeing, like right now, I'm sitting here, I'm going through some tweets here, and just about 25 minutes ago, come on, guys, switch. Bill Gates, co-founder of Microsoft, announced Tuesday he had tested positive for COVID-19, experiencing mild symptoms, said he will isolate until he is again healthy. Then we also have, let's see here, Professor Peter Hotez. We've had him on the show down with Texas Children's Hospital in Houston. He said he tested positive, moderate symptoms of fatigue, headache, sore throat, isolating at home, doing Zoom meetings. He says, I'm grateful to have been vaccinated, boosted, would certainly prevented more severe illness. Just started Paxlovid transmission up, be careful. We have this new variant out that is even more infectious. Can you explain to people how so? What is that?
So the new variant, which is called BA.2, is considered a subvariant of the Omicron variant or mutated form of the COVID-19 virus. And viruses are smart. They want to live, they want to spread and propagate themselves. So the virus mutates in such a way that changes its behavior or changes its impact on people. So we're seeing even more transmission of these newer variants of the virus. So you can spend less face-to-face time with a person and still become infected. And people are becoming symptomatic in shorter time frames than we saw with the original wild strains of the virus. And so we're seeing increased transmission, and to some degree we're seeing milder illness, but some of that is because we're seeing the illness in people who are vaccinated and or boosted. We're seeing some milder illness because people may have previously been infected, and we're seeing some milder illness just because the virus itself has changed However, that does not mean that COVID-19 is behaving like a common cold. It does not mean that people are not at risk to get complications like the pneumonia, the blood clots, the long COVID, or
Hmm.
long haulers, that we're still seeing huge and significant impacts with long hauler syndrome. We're learning more and more about that. And so even though some people have a milder illness, the hospitalization rates are again creeping upwards all over the country, including in areas where people are highly vaccinated. And so we still have to be careful. The whole country has really pulled their mask off, including in the Northeast, where we were really, really aggressive about slowing down the spread of
Hmm.
the virus in the beginning, and we've got bitten in the butt. Here in New
And,
York,
yep. Go ahead.
we were told by the mayor of New York City, the mask mandates will be dropped, and we want to open the city, and we want to see our city flourish. And that's important for financial reasons, but it doesn't work for public health issues and public health implications. So there was an increased number of cases, and our mayor had to put his tail between his legs and say, you know what, I know I promised, that we would be out of these masks, but they need to go back on. But once you have told people they don't have to wear their masks, it's really hard to get them back in without any state or federal mandates. So we don't have that anymore. People have gotten accustomed to being out and about without masks and gathering in crowds, and we are seeing the consequences of that right now. I
In
mean,
fact, in fact, this is an AP story. That's another tweet they posted 7 hours ago. We're becoming blind to
yeah.
what is happening with the virus because COVID-19 testing has plummeted globally.
Yep. Yeah, fortunately, people have access to home tests, and they are being diagnosed, and they can, call their primary and do a telehealth visit. But those cases are not being recorded. We don't open up our internet servers and see those COVID tickers anymore. So really, people have turned a blind eye to the fact that we are still living in a pandemic, and people continue to die. People continue to be hospitalized, and that will continue to be the case if we don't take it seriously. But I don't think that we're going to be able to reverse people's behaviors back to the earlier stages of the pandemic. And so, on an individual basis, we really have to assess our actual health risk, and we have to seriously assess our risk tolerance and really hunker down. I've never taken off my mask. I continue to wear my mask in my office, in public places, outside. If there's a lot of people around, I'm just not willing to see what's going to happen if I get this virus.
Now, here's what's interesting before I go to my panel to ask questions. And so I had never gotten this alert, and I don't know if any of my panelists have gotten this as well. And I was in a group chat with some other people, and it was the first time this actually happened. So when I was in Los Angeles, I was at the Maxwell concert. Then all of a sudden, ping on my phone. And then it comes up. It came from the DC Health Department, and it said that, give me 1 second. Let me do the screen share 1 second, because I want y'all to see this. And again, this is the first time I'd ever seen this. And I'm like, okay, did I get enrolled in something I wasn't aware of? And it came up and it said, you might have been exposed to COVID-19. The exposure notification system on your cell phone constantly scans and exchanges random tokens with the phones of people you are near to for 15 minutes or more. Then it said one of those people has tested positive for COVID-19. Based on the strength and duration of the signals between the two phones, DC Health believe it is likely you were in close contact with this person and you may have been exposed. If you're experiencing symptoms, recommend you self-quarantine. It goes through all the different directions there. I had not seen that before. Can you explain that? First of all, can you explain how I got that notice? Did we enroll in something? So explain this pinging of phones.
Yeah, so they are using technology to, try to help avert a public health crisis. The the problem with the pandemic is by the time people realized that they were infected, or but by the time people became symptomatic, they had already spent 2, 3, 4, 5 days engaging with other people, going to restaurants, going to wherever. And then they had already spread the virus to a number of people. In the beginning of the pandemic, there was this idea that you could use smartphone technology and the way our cell phones are tracked and pinged from towers to keep an eye on whether or not people were in proximity to other people who tested positive for COVID. But you used to be able to opt out of that. So it's not necessarily that you downloaded an app or that you're using something on your phone or that you accepted, okay, I'm going to allow my phone to be tracked and to tell me if I'm in proximity to people who tested positive for COVID. It's happening. And it's kind of like the smart technology that when you start talking about something or searching for something, every time you browse, now you're getting an advertisement for that thing you showed interest in, right? It's the same thing. This person who owns this phone tested positive for COVID-19, and their phone was next to Roland's phone. It was next to
And
Dr.
that means somebody tested positive, was entered into a system, and they still traveled.
Yeah. Well, there's no mandates, right? There's unless you leave the country, there's no rule that says you can't get on an airplane, a bus, a train, etc. We're working on the honor system, but we're, not a very honorable country these days. So,
Any questions from our panelists?
I have a question.
Go.
So, one, thank you so much for the information. It's been tough. Like I'm here in the city of Philadelphia, and kind of to your point about telling people to get masks and then turn over 3 days later you don't have to wear masks anymore. It's really trying. I guess, like, maybe what is your recommendation, so outside of just wearing a mask, because now we're told that we may need another booster. Do you recommend that people still stay on the every 6-month regimen to get a booster shot? Or do we just mask up and see what happens?
So, there's very hard data, and there's a very strong recommendation for people who are considered moderately to severely immunocompromised to definitely get that 4th dose. So that's our very elderly. That's people with conditions like cancer who may have chemotherapy treatments or radiation therapies, people who were born with immunocompromised states, and those people know who they are. People with HIV or AIDS that's not well controlled, their immune system is suppressed. People who have autoimmune diseases, they take more than 10 milligrams of prednisone or steroids on a daily basis, or other medicines that chronically suppress their immune system. Those people absolutely should get a 4th dose. And there's a very set schedule depending upon if you started with Pfizer, Moderna, or a Johnson & Johnson vaccine. And those 4 doses actually pan out to occur over a roughly 4-month period, depending on when you started your vaccine series. We don't all necessarily need to go out and get a 4th dose, but for those people who are at high risk to be hospitalized from COVID or high risk to die from COVID-19 infection should definitely get the 4th dose, and then it can be on a case-by-case basis. There's no checks when you go to present for a booster. They're really going to just be looking at your vaccine card, but there's no documentation in the system that says Dr. Alexea is moderate to severe immunocompromised and Roland isn't. They're relying on people's self-report. And if you're uncertain, really definitely talk to your doctor about that. The other thing to take into consideration would be, what is the likelihood that you are going to get exposed to COVID? Are you someone who is able to work from home, or are you taking public transportation to a office space that may be filled with people with different vaccine status, different mask wearing behaviors, and different levels of tolerance, right? If I keep my mask on all day, every day, and I'm vaccinated, it doesn't matter if the person sitting at the desk next to me is, hanging out with 50 people every time they leave the office. That still poses some risk of exposure. The thing we have to remember is that our vaccines are just that. They're vaccines. They help us avoid severe illness. They help us stay out of the hospital. They help us not die, and they prevent long COVID. But they do not prevent other people who are infected with COVID from breathing that virus on us. And it doesn't prevent us from getting an infection and potentially having symptoms. So it's not perfect, but it's absolutely better protection than doing nothing at all. And I don't recommend that anybody allow themselves to be a sitting duck, because long COVID is real and people are having really severe symptoms. And that syndrome affects literally every organ system in the body. And we have no definitive treatment or cure for long COVID. So beyond the initial, flu-like illness or, severe COVID-19 illness, however you experience it, still there's a significant proportion of people who will get long COVID without a vaccine protection.
Any other question, Demario or Mustafa?
Man, I don't have a question. I just want to say the doctor is so clear and concise. I appreciate what you're doing and explaining this to us. I have been thinking about, do I have to get another shot? Really don't want to take another shot. So you really cleared up some things in my mind, Doc. I sure appreciate you.
Absolutely. My pleasure.
Doc, I've had 5 friends in the last 2 weeks who have gotten infected with COVID. A couple of them 32, 33 years old and actually bedridden. The question is, one of them said the reason that they hadn't moved forward with getting boosted was they heard that they now had to bear the cost of that. Could you clear up for folks? Is there a cost associated with either the vaccines or the boosters?
No, there's no cost at all to get vaccinated for COVID-19.
In fact, Doc, I just let people know, like yesterday, I literally went to a grocery store, filled the form out. I was asked, do you have insurance or not? They only asked for the insurance for reporting purposes. It didn't cost me anything to get the booster.
Right. Yeah, there's no cost associated with getting a COVID-19 vaccine. And that's regardless of where you go get it, whether you get it at your local pharmacy, grocery store, whether you get it at your local Department of Health. I was about to name some big box stores, but I don't want to do that. But regardless of where you get your COVID-19 vaccine, it should not come at any out-of-pocket cost to you.
And again, I just want people to understand, all you have to do is, so if you do this here, let me pull it up. So if you send a text, I'm just gonna go ahead and do it so I can show y'all. Let's see, 438. So if you send a text message to 438-829, you should, and then you put in, let's see here, I'm putting our zip code here. So if you put in if you send a text to 438-829 and you put in so again, y'all, come on, show it now. What y'all doing? So here's a perfect example. I sent a text message to 438-829. I put in my zip code and it immediately gave me free sites near me where you can actually get the vaccine. And so it actually lists 2 CVS pharmacies near where our offices are. And so if you're watching, all you have to do to find out where you can get a free COVID vaccine, you literally send a text message to 438-829, 438-829. And they also still are doing free testing. So because I am traveling, I just got back from Los Angeles. I was in Miami. I was in LA for 6 days. I was in Miami for the F1 Miami Grand Prix. I'm traveling to Kansas City on Thursday for a town hall. Then we have a town hall in Cedar Hill in Dallas next week. So I went online today and I found, okay, who's still doing free COVID testing? I got to do a PCR test tomorrow just to make sure that, again, with all the traveling, all things that I've been going on, and like perfect example, like I'm allergic to smoke. And so I came into contact with a lot of smoke when I was in Miami. And so when that gets in my system, screws me up, but wanted to make sure that it's not COVID. And what is it? So I said, fine, we'll get the PCR test. So you still can just go online and literally type in free COVID testing and put in your zip code and it'll come up.
Yep. There's so many resources, and they're all by and large free. And the reason for that is because this is a public health issue. You may do just fine with your COVID-19 infection, but the person sitting at the bar next to you, on the bus, the train, at the birthday party, wedding, engagement party, baby shower, whatever, may become critically ill from that infection. So, we don't want to be responsible for getting somebody else sick, but we also, more importantly than that, want to take care of ourselves. And we need to know our COVID status, just like we need to know our HIV status, right? In the short term, COVID has some really huge implications, as well as in the long term. And so it's important to know, the masking behavior of the folks who you are visiting with, the people who you're socializing with. It's important to know what they're up to, right? Did they travel? Were they in a large crowd? Did they have symptoms? Did they test and make sure they don't have COVID? How did they test? Did they use a home test? Did they go get a PCR? What was the timing of the test? There's so much important things that we need to know and understand. But the most important thing to know and understand is that COVID is still with us. We're still in a pandemic. We definitely need to consider getting vaccinated and figure out whether or not you are someone who is at high risk. And if you qualify for a booster, please do go get it. A pain in the arm or a day of feeling achy or crummy or having fevers is a very small price to pay to prevent a critical illness, to prevent a death, to prevent chronic lung disease, and to prevent long COVID, which is a very, very serious outcome that has no specific intervention and no cure.
All right, then. Dr. Gaffney, we surely appreciate it. Thank you so very much.
Thanks for having me on.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. Folks, Black Star Network is here.
Hold no punches.
I'm real revolutionary right now.
Support this man, Black Media. He makes sure that our stories are told.
Thank you for being the voice of Black America, Roland.
Stay black. I love y'all.
All momentum we have now, we have to keep this going.
The video looks phenomenal.
See, there's a difference between Black Star Network and Black-owned media and something like CNN.
You can't be Black-owned media and be scared.
It's time to be smart.
Bring your eyeballs home.
You dig?